Again, if there's something I say that you want more information on, please ask me and we'll make a few other points. So this is what we're going to cover. We're going to talk about some general concepts. We'll talk about how to do measurements. We'll go into some arrhythmias. And obviously with 3 hours, I can't go through every single arrhythmia. So I'm going to try and point out the ones that are most important. There's a few definitions you have to get. This is really not extremely important from a nursing standpoint, but when a doctor talks about a Q wave, a QS wave, an R wave, you guys know what it is, but I want to give you the definitions because sometimes the definitions help you figure out what's going on. The Q wave is defined as the first downward wave, and we'll go through some EKGs, but the Q wave is the first downward wave. Sometimes there's no upward wave, okay? The first upward wave is the R wave. If there's no upward wave and you see a big downward Q wave, and it's very big, you call that a QS wave. That's just definition. Doesn't mean anything, it's a definition.
Complications of bleeding from the stomach from high-dose aspirin. And then patients who have a stroke due not to a clot that forms in the brain, but a clot that forms in the heart and then migrates or embolizes into the brain, we call it embolic stroke. Patients at risk for that kind of etiology of a stroke are patients with atrial fibrillation or patients who have mechanical artificial heart valves. And that's the reason those patients are usually placed on long-term anticoagulation with something called Coumadin or warfarin. The carotid artery disease is the carotid artery in your neck, which can cause cerebral ischemia due to blockage of inflow into the brain. And similarly, you can have cholesterol plaque that forms inside the carotid artery, similar to the coronary artery disease or cerebral vascular disease. One thing with the carotid artery disease is because it's a larger artery and we're not actually in the brain tissue, this makes it easier for us to treat